Hello, my name is Alicia Parsons, and in this video I will be completing a role play exercise of an interview for an assignment completion in Nursing 5382, Nursing and Healthcare Policy. Good afternoon, Senator Smith. I would like to start off by saying thank you for taking the time to meet with me to discuss the important topic of safe nurse staffing. There is a bill that has been proposed in Congress that deals with safe nurse staffing. It is H.R. 5052, Safe Staffing for Nurse and Patient Safety. Research has shown that there is a direct correlation in inadequate nurse staffing and negative patient outcomes. When a large number of patients are assigned per nurse, the higher the incidence of patient adverse events occurs, such as the administration of the wrong medication or doses, pressure ulcers, and injuries from falling after admission to the hospital. Research has also shown that there is a direct link to inadequate nurse staffing and an increase in healthcare worker fatigue. Healthcare worker fatigue can jeopardize patient safety, but proper nurse staffing policies and practices have been proven to be an effective strategy to reducing such fatigue and protecting patients. Currently, there is no federal regulation for the standard for the nurse-to-patient ratio or safe staffing. In fact, in the United States, there have been states that have enacted legislature that has adopted safe staffing practices, but they are all different. In fact, California has mandated a nurse staffing ratio. Texas has mandated a nurse staffing committee. And New York has mandated a disclosure of hospital nurse staffing levels. But there is no uniform mandate for the federal government from the federal government level to ensure that a standardized approach is taken and all organizations can be held to the standard and monitored for positive and negative outcomes as related to nurse staffing. The bill H.R. 5052 outlines that the hospital will create a staffing committee that will include registered nurses who provide direct care, managers, and specialty nurses. This hospital staffing committee will review research and redefine the safe staffing for nurses and patients. These staffing committees will be uniform across the nation. According to the American Nurses Association, increasing the number of registered nurses in the nurse-to-patient ratio has yielded a cost savings of $3 billion due to the reduction of 4 million avoidable extra hospital stays for adverse patient events. So as you can see, Senator Smith, adequate nurse staffing plays a vital role in the arena of patient safety, and H.R. 5052 is a needed addition federally to enact into law to ensure that nurses can continue to provide the safest care possible to the patients. Thank you, Senator Smith, for your time and meeting with me today.
Thank you.